So we will move to the Q&A session, and we will have few questions which we received from the different countries. But yes, we will try to cover up the maximum in the given time which we have. So we will start with the first question. That is, what are the best real-time quality control checks to ensure accurate imaging with avoiding repeated scans?
The right side and you have to the wrong side. So first of all, you have to make sure about the patient ID and identification. Secondly, I think during the scans, the positioning of the patient is very important. So I think the doctor and the radiographer must explain the patient and tell him that what needs to be done during the scans. And thirdly, and if at all, you should have a real-time check of the scans. So if the scan has not been what is the required quality and the required results, they can repeat it immediately rather than to give a dose next time. I think these are the few things from my side which I can say.
Yeah, that's great, sir.
Yes.
Yeah.
Yes, sir. So we will move to another question. Like if we give the MRI and the CT contrast, that is the CT contrast media on the same day, what contrast media should be given the first?
If you give,
They want to do both the procedure on the same day. They want to give
Yes, sir.
isolated contrast and they want to give gadolinium contrast.
Gadolinium based
Same
contrast.
day.
Yes, sir. That is the question.
That's a pretty
Yeah.
real
I
really
just,
appreciate the question.
but I want to know what kind of case this is.
Okay. So this
So-
is
so
it's recommended or we should avoid it, sir?
If the patient has got a proper GFR creatinine level is okay, then it is like proper flushing and everything. It can be done. If it's
Maybe
like
in trauma cases. Maybe in
Yes.
trauma cases, this can
trauma
be done.
cases and all that.
exactly what I was saying, if the patient's GFR is on a healthier side, both
Hmm.
can be done one after the
Okay.
other. But if there is any chance of less GFR less than 30 or even less 45, 50, I think it's better to do the next day.
Which will be the first one? Will be means the contrast agent of the CT should be done first, then MRI. Means what is the preference should be given?
I can check, but in my opinion, I think there is no such sequence. You can do whatever you want if the doctor wants. See, sometimes what happens, for suppose you want to imagine a part. So for that part, doctor has one thing in the mind that he will do this first. And if the results are not appropriate, then the doctor goes to the second imaging part. So that's generally it's done.
Correct.
There
Rather
is
than-
no particular protocol existing, madam.
Yeah,
You can do
yeah.
anything. As per our
Yeah.
records are there is no particular protocol like that. You can do
But
it.
as per the volumes, the MRI uses less contrast. So I mean, it's if less volume of contrast they want to use initially, yeah. But this is not the proper answer for this.
Okay. Okay. So got it. I would like to go for another question. That is, how can we effectively identify and manage adverse reaction to contrast agent in real-time cases?
Pardon?
How to identify and manage adverse reaction to contrast media?
In our presentation now, we have been speaking about the symptoms. And according to the symptoms, like what we have presented now, you have to differentiate as per the symptoms. Sir, you can add on in this, sir, Kapil sir. It's better like. Yeah.
Sorry, can you please come again? What you
Now
said?
they are telling us that how do you identify a adverse event? That's
Yeah.
what we've been addressing. So just we can put over.
Patient
Yeah.
has to be monitored, I guess.
Yes. So, if I can add, suppose for you, any side effect, what Mr. Vijay was referring to, any adverse event. So, if any adverse event is happening, you report to the company or to the authority, and then we will require a complete set of details from you, and then we will do a causality assessment. Causality assessment meaning this AE, this adverse event is caused because of the disease of the patient, because of his factors, or it is caused because of the drug. So for you, the thing is, every adverse event you should report it to the company.
No,
It's very,
what
very
question was like how
Hey,
to identify like how do you classify it, whether it is mild, moderate, or severe? That is according to the symptoms we were discussing, sir.
yes.
What's the question? Yeah.
Okay.
Yeah, next question, madam. Yeah.
Yes. What are the most common side effect patient gets during a fluoroscopy and how to handle it? Means what are the major side effects? Means out of the side effects, what is the major one which is common?
Mostly in our experiences, we have come across rashes, chilling. These are the most happening reactions.
And means
Rashes and
how
chills.
handle those? So that is the one question. Yeah.
Medications are there, antihistamines.
So
Okay, sir.
I also agree this. देखिए what sometimes flushing of the skin,
Mm.
mild rashes. These are the most, sometimes some people may have slight nausea, headache. These are the common adverse reactions. And as we said, they can be very well managed by antihistaminics
Okay.
or steroids.
Got it, sir. We are getting one query, that is when isoosmolar contrast media is used, okay, and they are not getting the clarity in the image. Sometimes they have to reinsert it, okay, they have to take a second time the scan. So is it acceptable? Are we giving the extra amount of contrast media to a patient? That is the one query which we have received.
So ideally, if you are repeating the contrast and you're giving more contrast, ideally it should be done on the second day. Don't repeat the contrast the same day, because then you will be adding up the contrast and the risk of toxicity can increase.
No, the question was, sir, like isoosmolar contrast media, they are not getting the proper image. So
Yes.
it's actually the dosage.
They are asking if they want to give it. So if they want to give the same day or the next day.
No. They have given contrast media, isoosmolar. So when they are giving isoosmolar, basically the iodine content is little less from 350
Yes.
to 320. So that is one criteria. So we have a pack insert given where dosages are given for particular studies. So you have to, the question was like, we have to give higher dose of contrast. It depends
Yes.
on study, madam, what is the study going on and what is the patient weight. That is also very important while giving contrast. Patient weight also plays a very important role. What
And
is
the
the
case.
exposure time? What is the exposure time? What is the CT sequence or what is the sequencing going on? All these attributes are there while taking contrast imaging. So it
And
depends on the technician, like how he is doing the method.
and case, the kind of case also. If it is a
That's
brain
what-
case, then yes.
Yes.
Because 40 ml, 60 ml, 2 times, okay. More than 100 ml should be an issue.
Yeah.
100,
Because
150
here
ml.
iodine content is little less, it's 320 mg. So you have to increase the dosage.
Okay. Okay. So means we should give the high dosage to get the clarity on the image side,
Yeah, because
right?
when you're giving isoosmolar, the patient is mostly on a EGFR levels are not proper. Then only you prefer an isoosmolar contrast media. So when you prefer an isoosmolar contrast media, the basic thing is that the molecule itself is it's isoosmolar. So it is almost it maintains the osmolarity of blood. So your iodine content also is less in this. So that your imaging little there is a contrast is not so well highlighted like 350 mg. So you have to little increase the dosage.
Got it, sir. Got it for the insights.
Yeah.
Yes. The one question that is how can we reduce the patient anxiety and prevent the panic attacks during MRI or any CT scan procedures?
This is out of contrast question. Yeah.
No, it's
It
a
is what you
talent.
recommend. Means most of the people have that
How-
criteria.
See, claustrophobia is very common. It's very common in general population also. Everybody is afraid of closed spaces. So it is very common, claustrophobia, fear of closed spaces. But I think the pre-procedure counseling will drastically help to calm down the patient. And if the doctor and the radiographer feel still the patient has some amount of anxiety about the procedure after explaining them, I think it's better to give some little amount of anxiolytic, like maybe alprazolam or diazepam, maybe 30 minutes before the procedure, which will help them to calm down.
Okay, got it, sir. The last question that is related to the packaging part as well as the guidelines. So it is like once if we contrast media kept in the warmer and can be the same bottle of the contrast can be kept outside, then is there a difference in the
Until
chemical
unless
structure?
they don't keep it in a cold or under AC or something, if the temperature is maintained, it's okay. Generally, the contrast should be stored around 30 to 37 degrees, or let's say 28 to that 36, 37 degrees. But if you take it out from a warmer and if you keep it in a let's say gantry room or this thing, wherein the AC is working and all, then there suddenly the viscosity changes. So
Okay.
whenever possible, it should be kept in a warm place.
And mostly it is a one-time usage is recommended
Yeah,
for
yeah.
all contrast media, right?
Yes, yes.
Yes, sir. And just one interesting query for the Magnelic which we have received, that is most of the MRI contrast media comes in the pack of 10 ml. Means the Magnelic we have a 20 ml pack as well. Means why that is the difference? That is the.
Yeah, we have 10 ml also, no?
Yes, we have 10 ml, but what's the 20 ml? So they are just curious about that.
Government regulations, I don't know.
No, for larger usage, actually.
For a larger
Maybe
doses.
It becomes little economical, larger usage, that's all. Yeah.
Okay, so means that kind of doses it is used in what kind of this one indications, means any particular situation where such a kind of dose is
See, there
required.
was a case called as MR angiography, where
Okay.
your contrast is required little more than the traditional way of injecting. Yeah. So when you're doing an MR angiography or you're doing something like MR cholangiography, then you require more dosage of contrast. Am I right, sir, Kapil sir? Whether it is what we are addressing is right for this, that we are giving 20 ml. Sometimes contrast is used more.
Yeah, that's correct.
Yeah,
Sometimes
so
it-
when
yeah,
you're doing
yeah.
an MR angiography for cholangiography or something like that, you are particularly your interest is CBD, you are working on that area. So your contrast usage little bit goes up. So the dosage is little higher on this areas.
Oh.
Yeah.